when we talk back to school, we're talking about, you want to approach the schools with a spirit of cooperation, try to be friendly, be realistic and reasonable about your requests and your time frames that you're asking for things. Communication is super important. Whether you're doing in-person, virtual, or like a hybrid learning situation, you still want to get that plan together.
We thought that this entrance into school would be a great time to have either a first time ever, or for some of you, or for others, a refresher about 504 plans and transitioning to school. We are really lucky to have Laura Keller here from the ADA. She currently serves as I want to get the title right, the Director of State Government Affairs. And she oversees 9 states. Oregon is one of those. Laura, you're going to have to correct me if I'm wrong about any of this. So she is responsible for a lot of the advocacy, collaboration with legislators, policy making and development, and help kind of enacting laws that make insulin more accessible and promote prevention and health equity in the name of type 1 diabetes. So we are very grateful for that. And she's also an expert on 504 plans and accommodation, helping families through that. Without further ado, Laura, why don't you introduce yourself?
So my name is Laura Keller. I was diagnosed with type 1 diabetes when I was 25 years old. And I called the ADA to volunteer, and I got a job. And I started working for the ADA about a month after I called to volunteer. And I've been there. It'll be 22 years in November. And I know what you're saying. There's no way I could be that old. So thank you for that. I absolutely love working for the ADA. It's a passion. I do have 9 states that I currently cover for the ADA. Alaska, Oregon, Washington, Idaho, Montana, Utah, Arizona, New Mexico, and the District of Columbia. But Oregon does have the place in my heart. I'm born and raised Oregonian. I grew up in the Clackamas, Sunnyside area. My mom's a retired Kaiser nurse, still lives about 5 minutes from the hospital. So very happy to get to represent Oregon in diabetes. And just to touch on real quickly, the ADA was able to get our insulin copay cap bill passed this year in Oregon to cap insulin for people who need insulin. And so that will go into effect here soon. Very excited about that. So we worked very closely with our bill sponsor, Representative Schouten. If she happens to be a representative, please thank her for her sponsorship of that. I also have the privilege and the pleasure of being the ADA coordinator of the Oregon training program. So we have several of our nurse trainers on tonight. So Marsha Bryan's one of our nurse educators who does training for us, as well as Michelle Ashby is on. Sarah Goslin may jump on later, but for the way we're going to do this is I'm going to kind of just talk about what are normal accommodations, 504 plans, what should go into them, things like that. If you have medical questions about, using technology in school and how that works, I'm going to ask my trainers to kind of assist on that side, as I'm not a healthcare provider. I'm just a really strong advocate for people with diabetes. And so if there's any questions, you guys can ask any questions. I'm happy to go through that. And the ADA did create some materials that are specific to diabetes and COVID and those accommodations in school. And so we'll go through those things as well. So any questions before we get started?
This is Marsha, and I just wanted to mention we have Dr. Mustache here, Dr. Nicholson. So if people have medical questions, he can probably chime in there with that as well.
Absolutely. Absolutely.
I'm from Southwest Washington, so I do a lot of the Southwest Washington training, as does Michelle, to the different schools when we get a request that they would like the staff to have some extra training, and especially the glucagon training, because the nurses aren't able to delegate glucagon. So if you have a glucagon kit in the office, unless you have a full-time nurse, it's very probable that there's nobody at that school trained to give it in an emergency. So you might want to ask about that and have somebody come in and certify some people in case they ever did have an emergency. And we do a lot more than just glucagon. But.
Yes, they train on insulin, pumps, CGMs, and what Mark's talking about, for those of you who don't live in Southwest Washington, that is the PDA law, parent designated adult law, that Washington has, where they need to train on those things, where Oregon is different. and it's not a PDA system. So the system in Oregon, the laws in Oregon are slightly different for each state, which is actually fairly common. Most states have differing rules around those kinds of things. So, all right. So when we talk back to school, we're talking about, you want to approach the schools with a spirit of cooperation, try to be friendly, that kind of thing. Be realistic and reasonable about your requests and your time frames that you're asking for things. Communication is super important. Really try to communicate in writing as much as you can. That's helpful for everybody. As a parent with a child with diabetes, you're going to want to bring supplies, snacks, your quick acting form of glucose, glucagon, that kind of thing to school. Make sure your contact information is up to date. So several people, cell phones, phone numbers, things like that. And then when you can, encourage your child to wear a medical ID bracelet. I'm still waiting for my husband to buy me the diamond tennis bracelet with a nice type 1 diabetes chain. I would wear that every day if he can find it, but instead it's most of the time it's just plastic, but that's okay. So we're going to go through some of the legal protections. So first of all, when we're talking about legal protections in school, primarily we're talking about 504 plans. And 504 plans, for those of you who don't know, is a section of the Americans with Disabilities Act and the Rehabilitation Act of 1973 that was also updated. When the ADA worked with other disability groups, we had it updated in the late 90s and early 2000s, so that it was very clear that kids with diabetes, if you had type 1 diabetes in particular, you qualified for 504 plans. So there's also the Education Act, Individuals with Disabilities in Education Act, IDEA, and that is for students that have more than one disability. So not just diabetes. It might be, maybe you're blind and have diabetes. Maybe you have a hearing issue and diabetes. Maybe you have other learning disabilities, and diabetes would fall under an IDEA plan. So I'm just going to do some quick highlights right now about COVID, and then we'll go into more of that because I know that's something that interests a lot of people, and I want to make sure we have a lot of time for questions. But students with diabetes have legal rights regardless of whether we're in a pandemic. So your rights don't go away whether COVID is happening or not. So you still can have a 504 plan, an individual education plan, or other written accommodation plans. Whether you're doing in-person, virtual, or like a hybrid learning situation, you still want to get that plan together and you want to have that figured out for your student. Students with diabetes cannot be excluded from school-sponsored activities because of their diabetes during a pandemic. They still have to find a way to accommodate that student so they can fully participate in their education and their activities. And an individual assessment is still required, but it could be done virtually. And families and schools need to be open-minded about how to adapt to the changes and precautions related to COVID. So one example of that is there's a school district in Oregon that, just because of everything going on, they wanted to postpone the 504 meetings till October, but the student still has diabetes. So they needed to come to an agreement about what they would still do up until they can formalize the 504 plan, because that student's diabetes doesn't wait till October, if that makes sense. So still need to be adaptable and understandable, but still need to put some safeguards and things in place. And then the Americans with Disabilities Act also impacts, just so you know, daycares, camps, recreational programs, but does not apply to religious affiliated schools unless they get federal funding. So that is the line there. However, most religious schools do follow the Americans with Disabilities Act laws pretty closely. So everybody should start with the diabetes medical management plan, what comes from your providers. So the physicians can tell you about that if you have questions here in a little bit, but this is the foundation for the 504 plan. So this is really what is used to create your plan. It talks about kind of how diabetes is run throughout the day, what you're going to do, how much the student is capable of doing, those kinds of things. And so that's really important. And the pediatric endocrinology centers in Oregon are all dialed in. We work with those providers. We appreciate them very much, and they do a good job of creating these forms for their patients. It includes everything from emergency contact to the type of blood glucose monitor or CGM you use, how you want to handle exercise in sports. So if your child is active, But even if they're not, you still need to talk about things like PE, how they recognize highs and lows, what form of insulin administration. Is it a pump? Is it a pump that talks to a CGM? Do they use an insulin pen? Those kinds of things. And then what the meal snack schedules and the level of care are. So this is like the ADA version, but I know in Oregon we use a slightly different version, but just to give you an idea, that's kind of, it's just to know that 504 is a specific document. Now, the caveat to that is if you're in a meeting with your school and they say this is the 504 meeting and we're all agreeing to this, they don't have to have 504 written in big letters like it is here on the document. So as long as everybody agrees to it, that these are the accommodations and stuff, it doesn't have to be on a specific form that says 504 across the top, but it does have to be acknowledged that this is the 504 plan. And it is written document that you need because it creates clarity. It is something that everybody can come back to, and that's what gives you the legal protections you need, particularly as your student ages and they get into standardized testing and testing that impacts their academic eligibility and ability to go to college or a trade school. So parents should contact the school. It could be different. Sometimes it's a counselor, a school nurse, a principal who is the 504 coordinator. So you always want the teacher involved too. Anybody who's going to come in regular contact, if you can, get them to that meeting. Once they figure out that the child is eligible to do that, that's really the note from the doctor that says this child has type 1 diabetes and here's the diabetes medical management plan. Now, for COVID specifically, these are some sort of like reasonable accommodations so that even if your school is not requiring 6 feet of social distance between desks, you can ask for that and ask for that on the bus. So a reasonable accommodation is to say, you know, because it's COVID, I want a little 6 feet perimeter around and on the bus, which means that they would, you know, keep the seats around your child empty if that is something that you wanted. It's not a requirement, but these are things you could ask for. You could require that everyone in class keeps their mask on if they're not doing that. Provide separate spaces between, and I think this is actually a really smart idea, between well student nurse visits, like if they go to the nurse, and sick student visits. So right now with COVID, we don't know if a child's coming to the office because they have a stomach ache because maybe they didn't eat breakfast or something like that, or if they have a stomach ache because of COVID. And so one of the things that you can ask as a reasonable accommodation right now is to have 2 separate rooms for your kids to visit. So like all the kids who are just coming in for diabetes or asthma or things that are known, like, or a skin knee, you're on the playground, you got a skin knee, we know that's just a Band-Aid, can go to sort of the well kid room, but you can ask that they have a sick room for kids that may potentially have COVID or other flu-like symptoms so that they're not accidentally being in contact with those students. Things like cleaning the desk with disinfectant, counters, doorknobs, handles, light switches, etc. Drinking fountains, all that kind of stuff. You can ask what their cleaning processes are, ask to have more cleaning in the classroom. Obviously you don't want to share musical equipment and keyboards, things like that if you're in music class. And then here is our website. So these resources are available on our website. It's diabetes.org, resources, know your rights, safe at school laws, and then COVID resources. But if you go to our website and type in safe at school in the chat, in the thing, that you can also find that there, or you can just take a picture of this as well and see that. The other thing is access to distance learning if supported and authorized by the diabetes provider. So if your diabetes, your endocrinologist, your pediatric endocrinology team thinks it's best for your student, even if the class is meeting in person full time, you can still ask for that as an option to still get the same access. And again, that should be determined with you and your medical providers. If telehealth visits by the school are possible, that might be something that you want. So maybe it's with a school nurse, or other health resources could be available via telehealth as well through the school system. If that's something that you're interested in, You want full sponsored participation in all activities. So what that kind of means is, even if you were to choose to do a hybrid model or keep your student home for a lot of their core classes, but let's say they wanted to be in band, they can't keep you out of band just because you're not going to school for COVID reasons, if that makes sense. So you can ask for that accommodation as well. And then virtual learning accommodations access permit off-camera breaks for students with diabetes. I think that's important. If a student, is in class all day, they don't want to test their blood sugar while they're, on screen, or they need to go use the restroom. Those kinds of needs don't change just because we're in a virtual world. For me as an adult, my diabetes kit is right at my desk, it's always with me, and I still need to test throughout the day, even with a insulin pump and a CGM. So that's a reasonable accommodation. I know sometimes the teachers don't like it if the kids aren't face to face, like can't see them all the time, but students with diabetes can get that accommodation. And just really remember that your child still has rights, even though we're in a pandemic. I think the schools have done a good job of trying to navigate that, but things are still evolving and changing all the time. And so keep that in mind, that you still have those accommodations. So really, a formula for a safe and healthy school year is planning, education, training, communication, and teamwork. And so when you're working with the school, really try to think about, what you're asking for, how you're asking it. And sometimes there's a lot of extra stress, as Marcia said earlier, on these schools and these school nurses with COVID. And so try to be mindful of that, but you also want to protect your child, and your child still has rights. Other things you want to think about in terms of 504 planning, and that's like trained school staff to be available to assist with diabetes care on field trips, extracurricular activities, school sponsored events, no limitations with full participation, reasonable time instruction to make up assignments and tests missed due to diabetes or illness. So why this is super important, having that, is that if you don't have that accommodation about reasonable time to take tests or time to make up tests, if your blood sugar is too high or too low, especially when you're in high school, then they don't have to allow you to have that accommodation on your college prep tests, like your SATs or your ACTs. The easiest way is to ensure that is to say you had a 504 and show them your 504 and that it's in there. If not, you have to get a medical exception. And while the pediatric endocrinology side of things, they fill those out and in a timely fashion, it's much harder to get those accommodations with the actual college boards and things without that. So I strongly advise doing that, as well as it protects your child's GPA overall, particularly if they're college bound or they want to go to a particular trade school or something where their grades would be important. So you want to make sure that is there. As students get older and they're more able to self-manage, it doesn't mean you don't need a 504 plan. You still want them to be able to have absences due to diabetes. And so often that's extra absences. A lot of school districts might have a requirement of only so many missed days in a school year. And if you have more than that, sometimes they won't let kids graduate or move on to the next year. So it's really important to say you don't get penalized for doctor's visits, because you do have to do those during the day, during the school day, not on weekends and nights usually. And particularly if your kids play sports, you can't even do them after school because then they miss sports and things. So it's really important that you have that in place. Or if, let's say, they were to get sick, they might be sick longer just due to having type 1 diabetes. So it's really important. Being able to self-manage anywhere, anytime that's appropriate for that student is allowed. So if you want your students, whether you're in Oregon or Washington, to test in the classroom, that is allowed. If you want them to be able to test on the desk and in PE, on the playground, to carry their things on them, they can absolutely do that. Cell phones. So as your student gets older, a lot of schools have cell phone policies that they're not allowed to use the cell phone. But when you have a student with diabetes, you can have a reasonable accommodation to use your cell phone to communicate with a parent about their diabetes. Now, that being said, if your student is abusing that privilege or using their phone a lot, not just to communicate with parents about what their blood sugars are or to ask questions, the school can put some things in place to help monitor that or to limit that if the student is abusing that. So it doesn't give your student carte blanche to say, I have a cell phone and I can use it whenever I want and talk to my friends and all that. No, it's for medical use only. But that is a very reasonable accommodation to have a cell phone at school to use to communicate with a parent, particularly as they get older. With technology and CGMs, many parents have the CGM data on their phones, so they know, and they want to be able to contact their student and say, hey, your blood sugar is going down. Are you eating? Did you eat your lunch? That kind of thing. So that's definitely an accommodation. The other things I think, particularly with COVID, that are really important to think about is having a good sick day plan, not so much for your student at school, but for if the teacher's gone, because maybe the teacher's child was in a class with COVID and they can't go to school. So then that teacher can't go to school and, they're in quarantine. And so you want to make sure there's a very easy to see list that can be left for a substitute teacher that's in their desk that talks about who your student is, kind of some of the accommodations. And it's as simple as even putting in there, my child can drink more water in class, or my child can go to the bathroom more, because a lot of times schools will have policies like, you can't use the restroom during certain times. I've heard of situations where certain schools say it's not our turn to use the restroom. Only certain classes can go during these times. And some of that is because they're trying to limit exposure of kids to certain other kids and things like that. But a student with diabetes might need to if their blood sugar is high, for example, and they've been drinking a lot of water. So it's important that the substitute knows that, because it's really hard for your student, particularly when they're younger, to say, no, I have diabetes, right? If a substitute says no, they go up and they ask, and that's hard for a student. And so anytime we can over communicate in those situations about where they can test and treat and kind of what their daily schedule is to make it easier on that substitute, that's just going to help everybody. But also remember, when you have a sub, they do the best they can, right? So I want you to think about that. The other thing that is really important is to think about how you handle emergency lockdowns. I wish we were in a time where we didn't have to think about emergency lockdowns in school as much, and people like active shooters. Our kids now are doing active shooter drills at school in some places and things like that. But often in those things as well, students with diabetes might be wearing a pump. They might be needing to carry their backpack or their medical supplies on them. And the first responders and police may think it's not medical related. And so one of the things to do as a parent with a student with diabetes is to have the school, and you can do this as well, reach out to the local fire department and police department who respond to the school, and make sure they know they have a community liaison officer, that at that school, there's a student in this grade, in this classroom, that has type 1 diabetes, but also have the school put that in their emergency response plan, because it might not be perfect, but at least that makes things better in terms of how those kinds of emergencies could be handled. And so again, that's over communication. It's just kind of a smart thing to do now. And then also for those emergencies, if they are locked down in their classroom, or what that plan is for the school, make sure there's extra food and supplies for at least 24 hours, if not 72, if you can, extra food supplies, some extra insulin, things like that. I know that can be a financial hardship for some to be able to get those supplies to leave them at the school, but if you can, you want to do that with your emergency contact information, what the emergency plan is. You can talk to your healthcare provider about what a good emergency 3-day plan would look like, and how it would be usually reducing the amount of insulin that a student might take, but you want to have that on there just in case. And just like I said, over communicate that. I'm going to go through some resources, and then I'd love to kind of have my trainers talk about things from their perspective a little bit. And then we can also answer questions, because I think some of the best things out of these things is just kind of a question and answer. But just to show you some resources that the ADA does have available, we have all our Safe at School resources online. We're also doing them in Spanish. So we have a Spanish webinar now. It just happened this week. It was recorded yesterday in Spanish, but it'll be available online. So if you have Spanish speaking families, or you know someone who English is their second language and you think that would be helpful, they might find this presentation was done in greater detail, but completely in Spanish. So we will have that available online, which I think is pretty great. It's the first national Spanish speaking Safe at School presentation for families that we've done. We also have some information about going off to college. So as your students transition and they get older, we do have some information about kind of what that looks like. The college scenario is a little bit different, but they do have an office of disability office on campuses. And while you don't need to have the same 504 protections because you're an adult, in the college setting, it's good to register. I had one of my former campers. I used to run diabetes camp for the ADA up in Washington. And one of my former campers went to the University of Idaho, and I told his mom in one of these presentations, when you go to college, have him register. So we went to that office to register, and he walked out with a $5,000 scholarship for 4 years because he had type 1 diabetes, because they had someone who's given the University of Idaho, if you know anybody who wants to be a vandal, every year they have an endowment fund that gives $5,000 to students with diabetes for their collegiate career there, just because they have type 1. So you never know the good that can come out of just having your students stop by there. And then we also have our planning tools. So examples of what 504 plans are for and things, but also for the childcare setting. So we have great information in detail about managing diabetes in the childcare setting. A lot of these things can also be applied to camps and other, sports activities. These resources are pretty universal and can be used in those ways. And then, so we've got our Safe at School website. We're constantly, as things are evolving, updating our COVID-19 information. And then right now there's 3 PDFs, and I'll show you those here in a second. And then you can see all the other resources. If you have further questions, you can always email Ask ADA and get legal advice and information we can send out some of our information there. Okay, so we have some things for virtual learning with COVID-19, and these can be printed and shared. We have a section specifically on 504 and COVID-19, kind of making accommodations that you can see here. So I would encourage you, I've been talking a lot about these things, but you can print them as PDFs, share them with the school or other, care facilities that you might be in. I think they're pretty good documents. They talk a lot about why we came up with the data and where it came from. So you can see that as well. And then what to do if there's a long-term closure. And, I know this might sound silly, but encouraging your child's school in a time of COVID not to offer, perfect attendance awards, because it's not real. A lot of kids might miss for different reasons. Kids with diabetes might be doing a hybrid or a virtual, and then that's really kind of inequitable in that they couldn't win that award if they wanted to, if you're asking that your kid stays home, unless they accommodate your student and allow virtual attendance. So you want to ask about even things like that. What are they doing to incentivize kids to show up even for virtual learning, and make sure that that is something that your student with diabetes can actually accomplish. And then making sure that the school and the school staff is also notifying you as a parent if someone in the classroom has COVID. I think most schools are doing a good job of that now, but that's something that you just want to remind them that it's super extra important when you have a student with diabetes, just to be aware of that and to share that information. And then we also have how to develop the diabetes medical management plan, and some tips and some things to think about. And so it's all there. So we do have those resources as well for you. I know it was a lot of information.
I have a question. I'm curious about the kind of the lockdown protocols you have, because, or you're suggesting. and I guess I'm asking about that because especially as kids get older in middle school or high school, and they're not in any one room in particular,
Yeah.
and if they're providing insulin that needs to stay refrigerated, and lockdowns get complicated now, where sometimes it's like, I guess I have to say, I felt really proud because the other parents at our school, we thought, oh, if there's a lock, like we did do 13 different diabetes boxes for their multiple students at one of my son's school. And I was really, I thought we were thinking ahead so much. And then I thought, oh, but I wasn't thinking 3 days, nor was I thinking insulin and et cetera. So but once I get into middle school or high school and they're changing rooms, sometimes lockdowns are like, and maybe you can tell me more about what sort of the, when you say it's kind of a 3-day preparation for 3-day, what that kind of lockdown looks like, because we were thinking like some of their lockdowns they're literally in their room and they can't leave their room for however long. So what do you do when they're in multiple rooms in that scenario?
Yeah. So that's two separate questions. And two things there. One, when you have an older student, you still want to make sure the school makes the first responders, fire department, police officers, especially if in an active student shooter situation, because those students are going to be having their meters and stuff on them for sure, absolutely carrying that with them if they're going from class to class. And so it's just really important to say, hey, FYI, we do have students with diabetes there. It just makes it might not address all the communication issues, and that's obviously a high stress environment, but it's still smart to let them know, because then if a student says it's my diabetes stuff, they know that that's potentially a real thing. These students have diabetes things. So that's one. Two, so when we used to think about disasters, we used to think of more like, for example, I cover Montana, and parts of Montana get snowstorms where those kids are at school literally sometimes up to 3 days because they can't get buses or parents to the school because it snowed so fast and so hard they can't leave. Okay. So when we're talking like a 3-day, that's more of the, like, it's a natural disaster. There's been an earthquake, there's been a snowstorm, something like that. So the ideal is 3-day preparedness kit. That's the ideal. Now, if you can at least get 24 hours, the kits that you guys made, that hopefully we'll never even need those, right? But particularly if you live in an area that it snows heavily, you might want to consider adding more, because that's really what that mindset was for. Like, let's be extra careful, let's be extra prepared, particularly for natural disasters. When the first responders and everybody are going to be so busy and they know that kids are safe, if the school building's safe and they know that kids are there, right, they're going to go and try to get to all the people where maybe there's down power lines and things like that, right? Does that make sense?
Yeah.
So that's kind of the difference there. And I do understand that it can be hard with the insulin and keeping it refrigerated and all of that. But if, sometimes schools will have a refrigerator in the nurse's office, and in case of a lockdown, the nurse, if they can, goes to that and just grabs all that stuff, right? But so you want to talk to your school, to the school nurse, see how, it's just always good to ask them, how do you handle your emergencies, whether it's a active shooter or like a natural disaster, and find out. Your PTA at your school should also know, because the PTA is usually involved in that planning. I know when my child was in school, that's, I actually served on the PTA, and that was part of our planning. And we worked with local firefighters and stuff. They came in and did trainings for us. Like if there was like a, 3-day or a long-term emergency, we had they had a not a trailer, one of those big like shipping crates full of emergency water and extra stuff. And so we put, even though my child doesn't have diabetes, because I was on it, I was like, no, we need to have glucose tabs in there, and we need to have all these extra things just in case there's students with diabetes, because there were other students with diabetes at the school and you just never know. So it's just good to know what their policies and their procedures are.
That's helpful.
Yeah. So Marcia or Michelle, do either of you guys want to see how you're and talk a little bit about how you're handling COVID and prep for kids at schools? And before we get into that, I'm going to say one thing. With CGMs, there's a lot of extra communication. And so just be mindful as a parent that you want those teachers to respond to you in real time, but try not to be too overly like communicative so that you're stressing the teachers out if you're seeing things, if that makes sense. Like, try to figure out a nice balance of communication and understanding, because that can be very stressful, especially as a teacher is learning diabetes and getting to know with the school year and all of the COVID things and trying to get to know your student. So just keep that in mind, that there's a learning curve for them too.
Yeah, I don't know if everybody knows what the Safe at School program trainers do, but usually it's either the school nurse will contact one of us trainers or Laura, and then we communicate between all of us that they've requested a training, that they feel like their school needs more information about diabetes. All schools do modules or whatever, so they get some training in diabetes, but it's very minimal. But this goes above and beyond that. It usually takes a little over an hour. I mean, they always just want an hour, and I say, oh yeah, right, I'll be there for about an hour, and then an hour and a half later, because you can't teach. We do Diabetes 101, so I mean that's a whole hour in of itself almost. So you try to squeeze that in, and I have a slideshow that I use. The ADA has some videos. They're a little outdated, and they're trying to redo those. The hypoglycemia one is still pretty good, and if you have a child with diabetes that hasn't had a training, you can always refer some of their teachers to look at that. They do a pretty good job of kind of simulating how a kid might argue and deny their low and that sort of thing, and then the parent treats it. So I really focus on Diabetes 101. Hyperglycemia, I touch on a little bit, and yes, it's important, but try not to scare them that every time the blood sugar's over 150, somebody's panicking. That they've got time to look at they call it an IHP now, an individual health plan. That you've got time to look at that plan, talk to the nurse, talk to the parents, and decide what to do with those highs. You're not going to be calling an ambulance for a high. So I really focus a lot of my training on recognizing lows, because my theory or my whole mantra has always been, when all we had was the red boxes, it was my goal is that you never have to open this little red box, that this whole staff is going to be trained. They're going to recognize lows. They're going to know how to treat a low, and you'll never have to go to that glucagon. But a lot of these schools, those nurses, I was in Longview yesterday, and one nurse has 7 schools. She cannot be at those schools all the time. So if she doesn't happen to be there and there's nobody trained, that glucagon kit is worthless. So we do train on glucagon. And in Washington, like Laura was saying, it's a little different than other states. But in Washington, a diabetes educator trainer can come in, teach the staff, and we're not really delegating either. And then they sign forms that the parent is delegating. The parent is saying, you've had the training, I am delegating you to do these tasks for my child. If it's a little child in a really rural school that has a nurse maybe once every other week, we may be training secretaries how to count carbs, do blood sugar checks, give insulin, and do glucagon in an emergency, and the teachers all how to treat lows. As they get older, a lot of times it's just the glucagon. We need those coaches, PE teachers, and somebody at that school, if that nurse isn't there, to know how to give glucagon. And this is where I'm going to give my spiel, and I'm not being compensated anyway. But if there's any way that you can get these doctors to order either the Baqsimi nasal, or there's a new one, it's a auto pen for the schools, it's really helpful, because those red kits are intimidating. I mean, I sometimes have a hard time because the PDA is a voluntary. I have to get volunteers who are willing to undo those kits, mix them, swirl them. And, pre-COVID, I put on a fake leg thing, and they would sit on me and, give me a glucagon shot in the leg. And there were some schools, I'd be lucky to get one volunteer because they were so intimidated. They were so worried about their liability. But it's mandatory that the teachers in Washington, anyway, every single staff member is trained on EpiPens. And so if we can get these things that don't have needles, don't have to be mixed, my goal, and the nurses are working on this as well, is the nurses can train on this. When they're doing the EpiPen, they're going to train, we also have 3 kids with diabetes, and they have these. And because there's not a needle, I don't know if you guys have seen this one. I think this one's really cool. It's glucagon. It's stable. It's actually shelf life is 2 years. So it's a lot longer than the powder, which hopefully is the insurance companies are going to pay for it. And the rep said they are pretty good. I don't think Kaiser has it on their formulary yet, but I think it's coming. Kaiser does have the Baqsimi, the nasal. But anyway, you just pull red, and then I'm just going to do it on my forearm, but you would do it in the arm or the belly or the leg, anywhere there's bare skin. It's subcutaneous, and just push. And that's it. You've given glucagon. So it's pull red, push yellow, count 5. And I taught my 8-year-old how to do it in 5 minutes in case his mom ever needs it. My 8-year-old grandson. The Baqsimi, have you guys all seen the Baqsimi? It's nasal. I will give one caution. When you push it firmly so it's all in there, because we have had several parents in an emergency and you're excited. I'll get this is what, I have a lot of props because I'm really visual. Put it in there and they pushed it and it clicks first. And then they go, well, it didn't do anything. And then they go like that and it goes into the air and not into the person's nose. So when you give the Baqsimi, if you haven't had any training with a little trainer, you're gonna need to push it firmly till that little green thing is gone. So anyway, any questions about the trainings? I love doing it. Every year I say I'm gonna retire, but I just, some of the nurses are so supportive and a lot of the administration. I had a principal that came today at my training in Stevenson. So if we can win those in Vancouver, we did have some trouble with the Vancouver School District with some administrators actually discouraging their staff member from taking the training until one of the principal's sons was diagnosed. And so, that kind of made a difference because he became a real advocate for the training. Yeah. So anyway, Michelle, do you have anything to say about your trainings? She's also down here in Southwest Washington.
Yes, except today I was in Menlo, Washington. I don't know if I'm saying that right. It was very, very small. But Laura, the point you brought up about CGMs and how it can make things easier, but then being mindful if parents or caregivers are communicating with school staff because they're able to remotely see blood sugars doing some strange things. One of the teachers brought up for a training that I did actually this afternoon was that the parent was trying to get a hold of the teacher on her cell phone and was quite upset that the teacher was not responding. But the teacher had left her cell phone on the desk because she was out on the playground tending to the diabetic kiddo. So it was kind of a moment for everyone to realize that the teacher may not carry her phone with her all the time, but that does not mean that she's not paying attention and, choosing to have somebody stay at their desk with their phone or actually tend to the diabetic kiddo. The parent was then grateful that the staff person was not at her desk. So it's great technology, but definitely requires some communication and clear understanding of what the expectation would be as far as response times and such.
I think Laura and Kendra were both right on too. You can't expect them to, respond to every single little up, down arrow and everything else. I mean, a nurse yesterday told me she had 16 calls in one day from one parent. And they have 7 schools. So you have to find that balance, like Laura was saying, of, getting the kind of good control you want, but not just the expectation has to be realistic.
Yeah. And, here's another accommodation too that I want you to think about is as your kids are like going to lunch, I know that, a lot of times lunch times are like 20 minutes. And kids give insulin before they eat. Especially if they're social and they're chatty, they don't, they might not finish their meal. So it's also a reasonable accommodation to say that your child is permitted to finish their lunch, even if no one else is, if they've taken their insulin, right? If they take their insulin after lunch, after they've eaten, then that's different. But you can ask for that accommodation around meals, also snacks, or birthday treats. So you can either handle those one of 2 ways in that if there's a party at school, you can have a box of things at school that your child can take out that they know is a certain amount of carbohydrates, or you can set up a system in place, particularly when they're in grade school. If someone brings in like a treat of some kind, that the school notifies the parent what the treat is, what it looks like, about how many carbs if they know. Because there's a difference between a cupcake from like Safeway and a cupcake from Costco, right? Like they're totally different sizes. And so you need to know how much insulin to take. And so you want to have a plan for extra snacks or things like that as well, and how you want that handled. Do you want to be contacted? Does your student just go and grab something that they know that they can carb? But, you know, as a person who wears the CGM, you know, Marcia, your point of the arrows going up and down, sometimes, you know, I'll have taken insulin or whatever for maybe 5 or 10 minutes, arrows will be going up. But then if I just wait, sometimes it'll stop because I know I ate, and then, you know, the insulin kicks in, and I don't need to address every arrow. But you're going to want to keep an eye on that. 16 calls in a day is a little bit excessive and unreasonable, quite frankly. You're going to want to think about, okay, what are we calling on? Maybe you need to go back to your diabetes endocrinologist and have conversations about how do we adjust things, because for some too, going to school is different than being at home. And so, you know, maybe their routine's off, with their eating is different, whatever. So maybe there needs to be some adjustments made there. But think about things that you can do to reduce those types of things so that you're not having to make 16 calls in a day. That is a little much. And that's hard on the staff. It is. Yeah. Any other questions about, you know, ideas, things that you can, you know, ask for? I know you can have a fridge in the classroom, but for example, you can't ask the school to pay for it. So let's say you want a fridge in the classroom with your child's insulin and snacks. You can ask for the accommodation to go to Costco, buy that little mini fridge for like $50 and put it in the classroom, and that they can use, but you can't require the school to pay for it. So that would be, you know, it's kind of a silly thing, but it's one of those things where sometimes there are reasonable things to ask, but also unreasonable at the same time. So think about that. You want the bus driver to know if your child has diabetes, if they take the bus. And on the bus, if they do take the bus, most school districts have a policy that says kids cannot eat or drink on the bus. That does not apply to students with diabetes. So you need to make sure they're aware of that the bus driver knows if there's a student with diabetes on that bus, they can eat or drink, because often that's like about snack time, right? Depending on what time they get out of school and how long their bus ride is, things like that. And so you want to make sure that the bus driver as well is trained on Diabetes 101, like Marcia mentioned, that they're aware of what the highs and the lows are. And I completely agree. The more they know, the less chance we have of having issues and emergencies for students with diabetes. And so that is the ideal, getting everybody trained. We're doing these trainings right now, like they said, in Oregon and in Washington. They have done some virtual trainings as well. We've really tried to adapt the best that we can as well in these trainings. And these ladies are amazing. And we're really lucky that we have this. And quite frankly, Oregon and Southwest Washington should be the envy of everyone, because these trainings, the ADA does not have this program yet all across the country. So we're pretty lucky here. And they also do daycares and camps too. So not just schools.
Yeah, I was going to say, any other questions from families?
I just had a question regarding like because they have an immune disorder, and they're talking about the booster shot.
Yeah.
Is that something that our children, well, my daughter's 15, so she's vaccinated, but should she be looking at the booster shot to help her?
Yeah. So I'll take that question first, and then I'll turn it over to one of the physicians on the phone. But so from the ADA's perspective, we have been meeting with both the White House and the CDC to make sure that when boosters come out, that people with type 1 diabetes that are eligible, and that goes down to even in the kids' eligibility, we will be prioritized in that process. And we've had a lot of discussions about that. We're actively engaging on that to make sure that when those do get rolled out and as they're getting, is that people of any age with type 1 diabetes will be prioritized for a third dose. But if one of the physicians want to speak to kind of your thoughts on that as a healthcare provider, that would be great.
Yeah, I can chime in. I don't think at this point that autoimmune disorders that are not treated with steroids or other immunosuppressive drugs are are sort of categorized under the same conditions that that are qualifying for the third dose. That's all I know for right now. I'm certainly, paying attention. If that changes, absolutely, we want to start vaccinating. Well, we want to give a booster dose as soon as we can for anyone who would benefit from it. But I don't, as a physician, I'm also not in the group yet that can receive a booster dose. So we're all sort of waiting for our turn, and I would like to see, everyone with type 1 diabetes as close to the front of the line as possible, but they're not in that same category of autoimmune diseases that require drugs that suppress the immune system, if that makes sense.
Yeah, I think you're right, Dr. Mustache. I think people assume because their child has an autoimmune disease that they're immune compromised and immune suppressed, and that's not really the case. That just because you have any of the autoimmune diseases. Now, granted, if you get COVID, it's going to throw your diabetes control into a loop, and I think that's probably where you need to be moved up the chain before a totally healthy non-diabetic kid would be, because, and you guys know, I mean, you can't get a common cold without your blood sugars, acting up. But and correct me if I'm wrong, but just because you have an autoimmune disease doesn't mean you're immune suppressed. I know my daughter's probably healthier than the other two as far as not getting sick.
Absolutely, yeah. I mean, I think it definitely qualifies as a chronic illness, 100%, and something that could pose, complications and make your illness potentially, more serious. And so, there should there be some consideration along the line for, everyone who falls in that category to be sort of prioritized. I think so, but yeah, not in the same category as the immunosuppressed people.
Yeah, Mara, go ahead.
So I'm really interested in things in the 504 to be aware of when transitioning from elementary into middle school or from middle school into high school. Like, what specific accommodations should I be asking for?
So standardized testing, first and foremost. So any standardized test or testing, that is the most important thing, because that's when they really start looking at for grade, sometimes moving to the next grade, but as well as once you get into high school and those grades count in your college transcripts, if you don't have it in your 504 plan that your child can treat and test and retake tests if their blood sugar is low, then the school doesn't have to allow it. And most schools will say, oh, we will, of course we will. But what if the principal changes? What if the teacher changes? Those kinds of things. So it's super important because that helps them academically stay a good student. And sometimes schools will say, oh, your child's a great kid. They're a great student. They don't need a 504. Well, they don't need a 504 plan because they're bad. They need a 504 plan so they can stay a great student, so they can stay educated at the same rate and keep their equal access, right? It's about access. It's about equality. It's got nothing to do with whether or not they're a good kid or a bad kid. Even if their diabetes is incredibly well managed, let's say they wear a CGM and a pump and they do everything on their own, you still need that accommodation, because I'm 48 and I still have times when I've done everything right and my blood sugar still might be too high or too low, right? And don't even get me started when I eat pizza, because I still haven't figured pizza out very well in 20 years, okay? And so it's just one of those things that's really important. The extra absences is super important. I've heard of stories where there was a kid and he played football and he broke his leg. Well, his diabetes was okay managed, but the stress of everything, it kind of threw him off. It took him longer before he could get to school. He had a lot more appointments and he almost couldn't graduate because he had too many absences. So things like that have happened in the past. So you want to make sure you can have extra absences. And then I think the cell phone piece, I think, especially as they get older, is important, because often they are self-managing, they're moving from class to class, but they still might need some assistance or questions from you as a parent at some point. And so I think the cell phone has a reasonable accommodation. But again, you need to talk to your student about, this is for you to use for diabetes communication. And if you abuse it, the school can take that privilege away if they abuse it and they're using it for more than just diabetes communication, right? Beyond what they're allowed to. I know some schools allow their kids like during certain times to use their phones or whatever, but for diabetes related things, that is a very reasonable accommodation. I think those are the key. And particularly the standardized testing and the testing one is super important, because if they plan to go to college, any kind of secondary education, the boards are really, it's much harder to get those accommodations. And that's like a 4-hour test. I don't know if anyone remember taking the SATs, but I remember getting up. I went to Oregon City High School. That's where I went to Rex Putnam, graduated class of 91, Rex Putnam High School, Three Rivers League. I had to go over to Oregon City High School to take my SATs. And that was stressful. And that was a long time. And you can't just show up and say, I have diabetes, so I need to have my meter and extra snacks and stuff. You have to pre-arrange it. They have to approve it. And then they have to check those things to make sure you're not sneaking in something you shouldn't sneak in.
And I just will add on that note, not only do you have to pre-arrange it, but you have to pre-arrange it with pretty significant advance notice, like in the order of months, not weeks. And so once you know your child is getting to be, I don't know, actually, it seems like some of the standardized tests are going to just really may go away this, like maybe the last year or two, but there'll be probably other ones that come up. But in any case, if that's something you want to do, to make sure you build in sufficient time for the approval process, because it can take a long time.
And
even when you have all of the
if
information.
you don't have the accommodation, it takes even longer. So it's not something to mess around with.
Right.
Yeah.
I will say that it is 8 o'clock and we make an effort to try to wrap up really promptly. So I think, I want to thank you, Laura, for all, and the educators for providing us with such good information. And you provided the links to some of the resources that you discussed. This is really helpful. It's really pertinent this time of year. And it's something that I know, as I have a daughter she's in her first year of college, and just her experience of having done this since she was 5 at the elementary, middle, and high school level equipped her to going to talk to the disability services offices at her school and arranging her accommodations there. So it's not something that it's something they're going to need beyond school even. So really helpful to have the process. So I think we want to wrap up just in interest of everybody's time. And if anyone has any kind of last minute questions, now's a great time to ask them if Laura is available for another minute or two. But otherwise, we will have another parent session next month with the topic to be released soon. And we'll hope you'll be able to join us.
Yeah, and I put my email in the chat. So
Super.
if anybody wants to get a hold of me at any time, that's my email, lkeller@diabetes.org. I'm happy to answer further questions or things like that at any time. Or if you know of a school, a camp, whatever, that needs a school training or diabetes 101 training, things like that, you can also reach out to me and I can help get that scheduled with the appropriate trainer.
Hey, real quick, I just wanted to hop in. Those of you that don't know me, I'm Boo, one of the camp directors, and I do teach middle school. One of the most important things you can do as you navigate those transitions to different schools and different age groups is just be in communication. So early contact to the counselor as they're moving up to a new school, checking in with them about, hey, we have a 504 currently. We want to make sure we carry over those things. And then what works for you at this school so that you can work with them. As from the teacher side of things, sometimes I just get handed a 504 in a meeting and say, make sure that this is followed. But if I have a parent reach out and say like, oh, I have, my student has type 1, we want to make sure that these accommodations are being met. What is this going to look like in your classroom? Or if you don't know what it's going to look like in your classroom, let's work together to make sure we can do that. I've got over 250 students this year. So trying to keep track of all those 504s and all those different things can be complicated. Luckily for all of my students that have type 1, I'm a camp director at a camp for kids with type 1. So they have an unfair advantage, but just making sure you're communicating often. And then the more you can get your student to take some of that on and be an advocate for themselves, it can be very empowering for them. And also it kind of helps them get some piece of independence with it as well. And if a student comes to me and says, hey, I know that I need this, and I know that I'm allowed to have this, it's very impressive to me as a teacher, and definitely saves us some time as well. So
I know Brian's here. He's a firefighter down in Southern Oregon. What do you do with the kids with diabetes? Does anybody ever contact you, Brian?
Usually when we have an issue at school, an adult meets us either in front of the school or if it's out on the playground or football field, whatever. So usually an adult who's aware that the child has diabetes. And that way, you know, we're not coming upon someone who's out of it or unconscious without some sort of prior knowledge.
Thank you again, Laura, for all of the information. And I would just encourage people to reach out with questions to her if there's anything that wasn't covered tonight.